KTRS. Jim Wallace joins us, and Brent Cummings joins us. Jim, you are a Corporate Director of Business Development and Public Affairs for Chestnut Health Systems. Jim, thanks for joining us.
Thank you.
I need you to talk right into the microphone.
I'll do it.
And you can move the microphone, get it nice and comfortable. There you go. Brent Cummings, you're here, Director of Adult Substance Use Services at Chestnut Health Systems for Chestnut Health Systems. Brent, thanks for joining us.
Thank you. Yep.
You guys, I donated a on-air interview to the Archway Institute, and you guys purchased the auction item.
Yes, sir.
All right. So you guys paid the $1.2 million needed for this?
2.5.
Okay,
yeah,
there we
so.
go. What is Chestnut? Tell us about that.
Chestnut Health Systems is on the other side of the river, on the other side of the Mississippi,
Okay.
and we are a behavioral health organization, nationally accredited, and we do services from substance use to mental health to primary health. We're in 40 school districts doing prevention programming. We have offices in Belleville, Edwardsville, Maryville, Granite City.
Sure.
And adolescent substance use residential, recovery home, detox, and a lot going on over there because and you're a big advocate for the stigma of substance use over in St. Louis, and it's happening on both sides of the river, and it's a real travesty. So it was a no-brainer to make this auction item purchase and to get a chance to talk with you.
What are you seeing on the front lines of the opioid crisis?
Well, and I'm going to turn it over to Brent, who is our expert. But on both sides of the river, there's people dying. In Madison and St. Clair, where Chestnut Health Systems is the community mental health center, we're seeing 70 plus overdose deaths in Madison County, and really a similar number in St. Clair. What I see,
70 a month,
70 a year
70
overdose
a year.
deaths,
Okay,
which is similar in terms of stats on the Missouri side in the metro area. What I see, I've been with Chestnut about a year, but I spent 28 years in Missouri doing behavioral health services. And what I see is not a lot of good cooperation happening and collaboration happening across that Mississippi firewall. We don't get a lot of, we kind of reinvent the wheel, but there's a lot of good stuff happening on both sides, but it's bad, and there's people dying. And other than, some of the Narcan is helping out with some of those deaths being a little lower, there's overdoses happening all the time. But Brent can talk to you a little bit about what we're doing in terms of innovative best practices.
Brent, what is going on the front lines?
Yeah, well, we, like Jim mentioned, we're probably seeing about 130 overdose deaths a year. 2016, that's what we saw in Madison and St. Clair County. Chestnut's working really hard, though, to provide some innovative treatments to help address that type issue. Chestnut probably provides upwards of $7.7 million in treatment funding for substance use. We're the largest nonprofit provider outside of Chicago and Illinois, actually. And of that $7.7 million, we leverage about $4 million to help address this opioid issue through medication-assisted treatment, as well as treatment and recovery support services that are needed.
You said 70 in each county, 135, 140. How many overdoses, or how many people have you saved? What number of overdose Narcan? I guess, just whatever the terminology is. How many people have you saved from dying with the overdose?
That information we're trying to understand and get. We actually have a new grant, or opioid naloxone grant, over on the Illinois side that's going to better address that. We're getting some data that's helping us understand who all we're saving at this point. Right now, what we're able to identify right now is just the individuals that have unfortunately passed away.
So you can't even tell us how many people you've saved from overdose?
Yeah, at the current time, no. But this new grant that we have through the state is going to help us better understand and provide that information.
You mentioned there's not a lot of cooperation between the Illinois and Missouri. It seems like, from where I sit, there's not a lot of cooperation between rehab facilities and best practices. And if I break my arm and I go to 10 doctors are going to give me basically the same answer, right? But if I have a kid who is addicted to heroin, I go to 10 rehab facilities, I get 15 different answers. You guys want to touch on that?
Absolutely, and I think that's where we stand behind the rest of, when we talk about behavioral health and we talk about stigma And you gave the analogy with primary health. You break your arm, you get it fixed, and there's best practices for that. The same here, and I hear you on a weekly basis talk about Percy and Arca, and he's a guy that I've worked with for 10 plus years, and there are best practices, but sometimes we like to stay in our little kingdoms, and this is what we've always known, so this is what we're always going to do. And what you end up having is treatment as usual, as opposed to evidence-based treatment that has statistics and outcomes that show that recovery is possible, and there's good outcomes for that. I wanted to touch back on that, not being able to speak to the overdoses, not necessarily deaths. That naltrexone grant it's basically educating first responders, and then being able to give them the Narcan to prevent the overdoses. Right. And that's happening in Illinois. The same exact grant, it's a federal grant, is happening in Missouri. And just because myself and the director of the program in Missouri are now working together, we've kind of created that bond ourselves. We're not reinventing the wheel 5 minutes apart on both sides of the river, and all first responders are being educated, have it in hand, and then we're going to be able to collect that data to come back and say, this is how many we saved, and it's going to be enormous. If you talk to first responders out there, there are people being revived every day, and sometimes they go straight back to the drug and have to be revived the next day. It's just we don't have the hard data to prove this is a big issue.
I've heard that one person could be revived 3 or 4 times in a given week.
Yeah. In Granite City alone, I was talking to an executive over there who runs one of their hospitals. They're seeing upwards of 10 to 12 individuals coming in their hospital a day, and some of those are repeats that unfortunately continue to struggle with
Just
that.
so people understand, if they weren't given this Narcan, these people would be dead.
Absolutely. Yeah.
So the 70 deaths a year are the 70 people who didn't get to the Narcan soon enough. Mm-hmm. I mean, it's almost like science fiction in that there's this anecdote that if given in the right time, it can save you.
Yep.
Right? I mean, it's almost like a science fiction movie.
Absolutely. And again, going back to that primary health, if there were 1,000 people in the St. Louis metro area dying of a public health disease, tuberculosis, we would be on shutdown, we would be on quarantine. But because of stigma and because of you just shouldn't do drugs, that's not the case. And people are dying every day in all walks of life and all economic levels. And folks like you, McGraw, Archway, Arca, and Chestnut is trying to jump in there just as well and get the word out and break down this stigma so we can continue to save lives. The tools are there. It's people aren't using them.
What about doctors? Because so much has been talked about doctors and giving medical-grade heroin for pain relief. Is it getting any better? Are the doctors more aware? Are the patients getting smarter? Are the people who are addicted not hearing the message? Where are we with this?
Yeah, I think it's getting better. It's one of the big emphases of Illinois to better understand and educate prescribers this upcoming year, to work with these individuals to hopefully help them understand that providing them with upwards of, I was talking to a state representative a couple weeks ago, and a dentist provided someone she knew with over 90 hydrocodone pills for a simple wisdom tooth extraction. So there's still need and still issues there that we need to look at. We need to look at using our prescription drug monitoring programs in a more successful way. But it all comes down to getting everyone to the table and helping us kind of look at what we need to do to support each other.
One more question before we let you go here. What would you tell a parent who has a child who is petrified to let them out of their sight because of the world out there, and that they've told them all the right things to do and be careful and watch out, but you send them out to school and there are bad guys at every corner? What do you tell the parents of teenage kids?
I would tell them to keep loving their child and keep help listening to them and spend time with them each night to better understand what they're dealing with, and looking at what their support system is like, and getting them involved in some pro-social activities that help kind of promote better, positive choices, and getting them around individuals that can hopefully support them, as more conducive to a lifestyle that's positive.
What should a parent look for maybe their kid is involved with drugs and they don't believe it? What are some of the triggers they should look for?
Well, signs like people not, adolescents not sleeping well, being tired all the time, things coming up missing. They're starting not to enjoy things that they used to. They used to play basketball all the time. They all of a sudden stopped doing those kind of things. Their friends change. All kinds of stuff.
And I would say, McGraw, with that analogy you just used, they're absolutely right. All of those things do exist, and the best thing that those parents can do is be educated on the resources that are out there, and ask and ask and ask, and when they see those signs and symptoms that Brent just talked about, reach out. There's help out there. It's just not obvious, and there's a lot of reasons for that.
Is heroin in every single high school in the St. Louis metropolitan area?
I would say absolutely.
Yes.
I mean, whether they want to acknowledge it or not, absolutely. And
Yes.
the unfortunate thing now is the heroin issue became a fentanyl issue, which
Right.
is something that's even more potent than heroin. So that's out there and available around the clock now as
Is
well.
it easier to get heroin as a 16-year-old kid than a six-pack of beer?
I would honestly say so at this point. Absolutely. People are routinely willing and able to sell this stuff to kids and get them hooked to, continue to prosper themselves, unfortunately.
Is the heroin epidemic helping the sex trade epidemic that's out there?
I think it all ties together. I think there wouldn't be too hard to connect those dots, whether it's the sexual trafficking, the heroin, all of that ties together, and it needs to be looked at. I mean, that's a whole nother story to talk
Right.
about, but sex trafficking is probably something else that happens right in front of us, and we kind of tend to look the other way. Same way with heroin, and same way with drugs and alcohol.
Chestnut Health Systems, how do people find out more?
Real easy, chestnut.org. And if they really need to get a hold of me, I'm an easy guy to find. But I would go to the website, chestnut.org.
Chestnut.org. That is Jim Wallace, Corporate Director of Business Development and Public Affairs for Chestnut Health Systems, and Brent Cummings, Director of Adult Substance Use. Gentlemen, thanks for coming in, and thanks for your support.